time for just a quick video trying to explain the difference between cognitive therapy and cognitive behavioral therapy, or what's also known as CBT. These two things get confused all the time. I have referrals to my office that say this person needs CBT, and I have to turn back to that referral source and say that is not what I do. My name is Hillary. I am a speech language pathologist who specializes in concussion and cognitive rehabilitation, so cognitive therapy. There's two big differences. One is who is going to provide cognitive therapy versus cognitive behavioral therapy. Speech language pathologists are typically the ones doing cognitive therapy. Sometimes it can also be done with an occupational therapist as well. There's some overlap. And then CBT is going to be done by a psychologist, a licensed therapist, some type of counselor, somebody who has more of that kind of emotional stuff. So what I'm going to do is I'm going to work in the areas of attention, memory, language communication, executive functioning skills, which are all of the high-level skills that we need in a day, and processing speed. I'm typically going to see patients after some type of injury, concussion, stroke, even progressive neurological diseases. You can have support with cognitive therapy. Sometimes I might work with things like ADHD and things like that, because what cognitive therapy is meant to do, it is meant to support, compensate, enhance, and maybe remediate if there's like a rehabilitative thing that we can do. So think about how you function in your day-to-day, and can we improve on that? Can we make it better? Cognitive behavioral therapy is looking to address emotional and psychological issues, things like depression, anxiety, trauma, and stress. And specifically, it is working to kind of reduce distress, changing your behavior, changing how you think about your behavior, and all of those things. Both are extremely valid. Definitely good. I'm not saying that what I do is better than CBT, but it's just something that I don't do. It's a completely different therapy. It's a completely different need for that therapy, a completely different provider. So if you ever hear me talking about cognitive therapy and you're thinking CBT, refer back to this video because that's not what I do. And if you need CBT, by all means grab it. If you need cognitive therapy, awesome, let's get that. And sometimes you need both at the same time. Again, two different therapists, two different goals within those therapies. So hope that helps to clear up any type of kind of confusion or just like a misnomer out there. Cognitive therapy does not equal cognitive behavioral therapy.